like to remind you that this is the metaverse itself is a little bit like your real life, all right? So if you're speaking, if you're talking, your neighbors can actually hear you in a close proximity. So later on during the pitching session itself, just be reminded to mute your speaker, okay? Keep yourself muted if you're not talking, if you would like to enjoy. If not, if you're talking, the person next to you can actually hear. If there's any background noise, the person next to you can actually hear. So it might be a little bit distracting. So remember to just mute yourself when you're not speaking, when you're not talking. If you'd like to engage, have a chat with the person next to you, feel free to take it off to somewhere further away from the rest of the crowd so that the others can also enjoy the pitch session itself. All right. Thank you. We will begin shortly. Thank you.
Mà坐邊度啊？
I'm looking for Andre, Mr. Andre from Let M China Tech. If you're here, please come on up to the stage, Mr. Andre, if you're here, and also Wang Dan from Typing Innovation Capital. If you are here, please come on up to the stage. Mr. Andre from Let M China Tech, as well as Wang Dan from Typing Innovation Capital. If you're here, seated in the audience, okay, I see you, Wang Dan. Okay, give me a second. Let me grant you access to the stage. Hi, Wang Dan.
他就在边上。医生，你要跟着我一起去跟那个副总理这边打个招呼吗？
Okay.
Can you hear me?
Stanley, I need help on the access to the stage. Right here. Right
Yeah,
here.
give me a second. Hey, Wang Dan, can you follow me? Thank you. Last call for Andre from Let M China Tech. If you are here, please let me know. Come on up to the stage where I can see you. And ladies and gentlemen, distinguished guests, friends, technologists, everybody from the same sphere of innovation, thank you for joining us today, this morning, on a Sunday morning to this event. We are going to kickstart right away, okay? Before we begin, let me introduce myself. My name is Stanley, and I'm from the Beyond Organizing Committee. I will be your host for this morning, right? Before we kickstart today's session, I would just like to remind you that you are actually at the Pitch Roadshow for Science and Technology Enterprise from Brazil and Portugal. All right, welcome once again. Gentle reminder to our audiences on the floor that you will be able to hear one another, okay, because you guys are seated in close proximity. And the setting here on the metaverse is that if you're standing close to each other or if you're sitting next to one another, we can actually hear your neighbor, all right? So just to be kind and considerate to your neighbors who are listening into the pitch, please mute yourself, okay, if you're not speaking, and just in case any background noises, distracts our friends while listening to the pitch, okay? And also, if you'd like to connect and engage with any of the startups here today, we have 12 startups from Portugal and Brazil that are here today to pitch. Some of them will be in video form, and some of them are here live, all right? So please feel free to do so at the business matching venue later on at 12 p.m. Macau time, okay? We're expecting to end off a little bit earlier. So if we end off earlier with the pitch, we can all make our way to the business matching venue to interact, have a one-to-one conversation with startups or with whoever is here, all right? So how do you get to the business matching venue? On the top left, on the left-hand side of your screen, you see a panel of icons. And on the top, the first icon, click on that, and you can select the venue that you would like to head on over to, all right? So the business matching venue is the place that we will be engaging one-to-one, have a chat with the panel of the judges, the investors that are here, and also our friends who are down here at the networking platform, all right? Thank you so much for waiting. We are slightly behind time, but not to worry, we will catch up with the schedule itself. All right. Now, let me formally introduce and kickstart this event right now. Today's main organizer of the session, we have to thank the Macau Economic and Technological Development Bureau for making this happen. We thank the Macau Economic and Technology Development Bureau for putting this together, for bringing in all the startups that are here with this wonderful opportunity to engage and share what they have with you guys that are here joining us today. Together, we also have several co-organizers. Our co-organizers include the Jiangsu Provincial Department of Science and Technology, the Guangzhou Municipal Science and Technology Bureau, the Economic Development Bureau of Guangdong, Macau, In-Depth Cooperation Zone in Hengqin, as well as the Zhuhai Municipal Science and Technology Innovation Bureau. So thank you to all organizers and co-organizers for making this happen today. Now, if you're off stage, if you can hear me, please give a round of applause, the thumbs up. You can do some signs up here. Thank our organizers, clap, thank you. Thank you so much for your support and making this happen. And thank you all for being here to join us to witness the pitches. Okay, now before we kickstart with the pitch itself, I'll just run you guys through what's going to happen for today. We are going to have some video keynote sharing by our organizers before we proceed with the pitching event officially. Okay, so I would like to kickstart with our first keynote video by Mr. Tai Kin Ip. He's the director of Macau Economic and Technological Development Bureau. He will have a short sharing, so feast your eyes on the big screen in front of you and enjoy. Thank you.
各位嘉宾，大家好！今天很高兴与各位嘉宾以来自巴西和葡萄牙的科创企业一同来到元宇宙，参加巴葡科技企业路演专场的活动。在此，我仅代表澳门经济及科技发展局向各位代表表示热烈的欢迎。并期待接下来的路演活动能够顺利的举行。为推动澳门融入国家发展大局，建设粤港澳大湾区国际科技创新中心，同时为配合澳门经济适度多元发展的需要，以及充分发挥澳门作为中葡交流平台的优势，澳门特区政府近年来一直与葡语国家，特别是巴西以及葡萄牙的高校、企业以及孵化器等进行紧密的联系交流，建立了良好的合作关系。虽然新冠疫情使人员的流动受阻，但科技令我们的交流保持畅通。这次的路演，经科局首次在元宇宙世界举办巴葡科技企业路演专场的活动，让高素质、有潜力、较成熟的巴葡科技创新项目引来澳门，创造与来自内地以及国际的投资人对接洽谈的机会。一方面能让巴葡科企了解澳秦以及大湾区的现况与机遇，另一方面也能体现澳门作为中葡平台的重要的作用。此外，为更善用元宇宙这个跨越地域的空间，我们为这些参与路演的企业在 Beyond 的展会中提供了展位，让他们展示自身的科创的产品。同时，本局也设有中葡科技交流合作展示区，向大家介绍本局的职能，特别是在建设中葡科技交流合作中心上的工作。希望各位可以在路演后前往了解。值得一提的是，巴葡科技企业创新创业大赛将会在今年继续举办，将围绕大健康和新材料两大主题进行，共有14支来自巴西以及葡萄牙的队伍参加。决赛就在几天后的9月29日，欢迎有兴趣的各位一起来参与。最后，希望本次的路演可以使企业家和投资者与巴葡的科创团队成功的配对，让企业家以及投资者可以好好的运用手上的资源，推动产业的未来发展。同时也让巴葡的科创企业可以考虑落户澳门发展，继而进军庞大的中国的内地市场，互惠互利，合作共赢。我祝愿本次的活动圆满的成功，谢谢大家。
Okay, thank you very much for the opening speech, Mr. Tai Kin Yip, once again, Director of Macau Economic and Technological Development Bureau. All right, I can see that you guys are already very familiar with the, all the functions and the features, the buttons of this metaverse. Great, feel free to, use the clap more often if you like. Okay, and next up we have a second video by the founder and CEO of Fabrica, the startups Portugal. We have Dr. Antonio Lucena de Faria that will be sharing with us his a short speech about today's event. Please enjoy.
First of all, I'd like to congratulate the organizers of the Beyond Expo Macau for making this event possible. I truly believe that Beyond Expo will be a major contributor to position Macau as a hub for entrepreneurs that are looking to expand their business in China and in particular into the Great Bay Area. I also believe that Macau can have an important role in helping entrepreneurs from the Great Bay Area to grow their business in Europe, Latin America, and Africa. Macau has unique characteristics to position itself as a translator of cultures and facilitator of business partnerships involving entrepreneurs, startups, companies from different parts of the world, while at the same time fostering the Macau entrepreneurship ecosystem. Startups that want to expand their business to China, or startups from China that want to grow globally, will need different services that entrepreneurs from Macau will be able to provide. Beyond Expo, presence on the metaverse not only facilitates the exchange of information, making it possible for startups in healthcare, sustainability, consumer tech to get exposure, and also for participants to learn about the metaverse and learn about entrepreneurship. I wish all participants, startups, scale-ups, investors, a great experience. I'm sure a lot of relationships will be established during the Beyond Expo, and investors will find high potential businesses to finance. I'm sure that this event will contribute for entrepreneurs to consider Macau as a great location to find new ways to expand their businesses. As CEO of Fábrica de Startups, we are honored to participate in this extraordinary event, and we thank the organizers for giving us the opportunity to bring several startups and scale-ups from Portugal and Brazil to pitch their projects. I look forward to visit Macau again and be part of Beyond Expo Macau in 2023. Thank you very much.
To Dr. Antonio Lucena de Faria, founder and CEO of Fabrica de Startups Portugal. Thank you once again. And ladies and gentlemen, we have a third video by our co-organizer, Mr. Wang Qing. Mr. Wang Qing is the Director General of Jiangsu Provincial Department of Science and Technology. Mr. Wang Qing will also be sharing his wishes and his thoughts about this morning's pitching session. Please give a round of applause.
戴建局长、女士们、先生们，大家好！非常高兴与大家相聚元宇宙，共同参加澳门国际科技创新博览会巴普科创企业路演活动。在此呢，我仅代表江苏省科技厅，向本次活动呢成功举办表示热烈的祝贺，向参会的各位来宾表示热烈的欢迎。去年12月呢，我们首次访问了澳门，期间和戴建局长签署了苏澳科技创新合作的备忘录。1年来呢，双方认真落实备忘录的内容，开展了多有成效的合作。江苏省科技厅设立了苏澳科技合作的专项，目前呢已经支持了6个江苏机构与澳门大学等创新实体的合作项目，支持的经费呢达到了590万元。下个月呢，江苏省科技厅还将组织高科技企业的代表团赴澳门参加内地与澳门产学研合作路演对接会，发挥澳门中葡平台的优势，推动江苏与葡语国家开展科技交流合作，是我们双方合作备忘录的重要内容。今年3月呢，我们双方首次共同举办了江苏与巴普科技企业 创新创业大赛获奖项目的对接交流会。在这个会上呢，有6家江苏的机构和3个获奖的项目进行了1对1的洽谈对接，取得了较好的效果。本次的巴普科创企业路演活动呢，也是通过我们澳门经科局搭建的平台，重点推动江苏医疗健康领域的创新机构与巴西、葡萄牙开展科技交流合作。希望双方充分利用好此次路演对接平台，加强交流互动，建立合作关系，形成合作项目，取得预期成效。最后呢，预祝本次活动圆满成功，祝各位来宾工作顺利，生活愉快，谢谢大家。
Once again, to Mr. Wang Qing, Director General of Jiangsu Provincial Department of Science and Technology, for his well wishes for this event. Up next, this would be our final video before we kickstart with the pitching session. We have Mr. Wang Lei. Hi, sorry. As
王琴厅长、建业局长、安东尼亚博士、各位来宾、女士们、先生们，大家下午好！非常欣喜以这样的方式亲临巴普科技企业路演活动现场，与各位共襄盛举。在此，我谨代表珠海市科技创新局，以诚挚的心情向巴普科技企业路演的成功举办表示衷心的祝贺，向举办方澳门特别行政区经济及科技发展局的邀请表示衷心的感谢，向燃宇宙里的嘉宾朋友们表示诚挚的问候。珠海作为唯一与港澳陆路相连的城市，唯有不断的强大自己，才能更好的肩负起服务澳门经济实多多元可持续发展的重任。近年来，珠海通过出政策、建载体、引企业、优环境，加快积极高端科技创新资源，进一步提升前市科技创新能力，奋力建设湾区新兴科技创新城市，在深度参与粤港澳大湾区国际科技创新中心建设的进程中，珠海不断的加强对外交流合作，加入澳门、横琴，共建中葡科技交流合作中心，打通中国与葡语系国家科技交流合作、创新资源融通、成果转化、人才汇集、产业发展的桥头堡。我注意到，这次路演活动的创造性应用了燃宇宙这个新兴的概念。作为时尚这一受瞩目的新型数字产业，燃宇宙正从未来时加速进入进行时。作为改革开放的怀特宾，珠海始终以创新的视野谋划和推动科技工作，充分利用港澳创新资源，探索多种多样的国际合作新模式，并积极地融入全球创新网络。在这里，借着巴普科技企业路演活动的东风，我们充分体验了燃宇宙这种新模式，沉浸式地参与到巴普科技企业路演活动中来，不仅帮助我们更好地了解葡语系国家的发展状况和最前沿的技术以及科技成果，也为我们未来的工作开拓了思路。最后，再次感谢主办方邀请我参加这一盛会，也祝各位嘉宾朋友们身体健康，工作顺利，谢谢大家。
Mr. Wang Lei, Director General of Zhuhai Municipal Science and Technology Innovation Bureau. Thank you. Thank you to Mr. Wang Lei. Everybody, thank you so much. We are going to kickstart the pitch for today's session. Once again, let's give a final round of applause to all our organizers for making this happen today. All right. If you can do the dance. Do the dance. If you can clap, you can clap, And let me now introduce our panel of investors. that are here to join us on stage to witness today's session. Today, we have with us 6 representatives that are on stage. If you can see, our representatives, investors are on the stage right now. They will be taking a seat at the red sofa just underneath the big screen. So let me first introduce our investors that are here today with us. Okay, first of all, I'd like to welcome Mr. Randy Tan, Investment Director of Kairos Capital. All right, please give him a round of applause if you can. All right, Mr. Randy Tan, Investment Director of Kairos Capital. Next, we have Mr. Supawat Stamp Suksantiswat, Investor at Creative Ventures. Welcome, Mr. Stamp. Next, we have Chong, Mr. Chong from Yale Capital, founding partner of Yale Capital. Mr. Chong, thank you for joining us today. Also joining us this morning, we have Ms. Zhu Tiantian. Ms. Zhu Tiantian is the Vice President of Strategic Investment of New Frontier. Right, New Frontier is a chain of hospitals that's based in Macau. Right. And up next, we have Wang Dan, Executive Director of Taiping Innovation Capital. Ms. Wang Dan is joining us this morning as well for this morning's session. Last but not least, we have Mr. Jason Ho, co-founder of Beyond Expo, who is here with us this morning as well. Welcome to Mr. Jason. And of course, to all our investors this morning, thank you so much for taking the time to join us on stage. All right. Once again, a gentle reminder to all of our audiences on the floor as well as on stage. So if you're seated on the floor on the seats, you will not be visible or audible from the stage, but you can actually be heard by your neighbor. So remember to keep yourself muted if you're not speaking, so that the people around you can actually enjoy a good listening in to the pitch today. And to our VCs, our investors on stage, please be reminded to also keep yourself muted and unmute yourself when I call upon your name for the question and answer portion. All right, thank you so much. Ladies and gentlemen, we will kickstart with the pitch right away. And just a gentle reminder that each pitch, the format today will be a 10-minute session. So each one of our 12 startups here will get 10 minutes to pitch. And within the 10 minutes itself, there will be a 2-minute question and answer portion with the audience, with the VCs, with the investors. All right, our panel of judges that are seated on stage. So if you have any questions or if you'd like to engage with the startups, once again, you can do so at the business matching venue later on after the pitch today. All right, thank you. So very quickly, let me invite our first pitch for this morning. Our first pitch for this morning is represented by Ms. Anna Katerina Gomez of CBR Genomics. Ms. Anna, please join us on stage. Thank you. Ms. Anna, can you hear us?
Yes.
Wonderful. Thank you for joining us this morning. I understand that it's really late over at where you are at. The stage is yours. You have the next 10 minutes. Whenever you're ready, you can do a share screen, and I will start the countdown when you start speaking. All right? The floor is yours. I'll give you a reminder later on at the 1-minute mark. Thank you.
Okay. Thank you so much for the invitation and for the opportunity to be here. So my screen is sharing, right? So I am Ana Catarina Gomes, the CEO and leader of CBR Genomics, and I lead a team that aims to help families thrive through DNA screening. So did you know that 1 in every 10 children has a mutation that causes a natural pediatric disease? That 1 in every 6 people, yes, 1 in every 6 of us here has a personal risk for an actionable monogenic disorder. So there is action to be taken. And if you think in cancers, 1 in every 10 are hereditary. So preventive actions can really, really save lives, especially in the young. So DNA screening has been kind of the elephant in the room. Everyone knows that it's the future, but it's getting late to save lives. And so at CBR Genomics, we decided to face the elephant, and we have asked a very, very simple question. If from birth to death our genes are the same, then why don't we sequence all our 20,000 genes and store the data for future use? So this is the technology that we have developed and patented. So from a simple saliva sample that is collected in a very painless way, we can actually analyze all our 20,000 genes and give results on those actionable genetic diseases.
Cut you off here. Anna, can you hear us? We can't hear you right now. So maybe you want to try turning off the microphone and turning it on back again. Okay. Can you unmute yourself and try again? Well, this sort of things happen most of the time, and especially on technical platforms. Give us a moment, our audiences. It says that you're unmuted, but we cannot hear you. Can the rest of you here on off the stage in the audiences hear Anna? If you can, do a signal. Wave your hand or something. Can our investors hear us?
Yeah.
Okay.
Not Anna.
Not Anna. Anna, I'm going to pause the timing here for a bit. Why don't you refresh the screen and we come back in again. We'll give you a minute. Okay? If you can hear me, you can refresh your screen and join us back in again. We'll kickstart from where you were from. Not to worry. We will get Anna back. Yes, Anna, you're back.
Yeah,
Great.
yes.
Let's get you back on track. It's all.
I just help me. So you've listened to this one?
Yeah, it's probably a network issue, but not to worry. We are back at the same slide that you were stopping at. So you can continue where you left off.
It was here, right, that you have left off. So, okay,
Yes.
so with this principle, we have developed the DNA Files Baby, which is the most comprehensive screening for babies once they are born. And we can actually screen for over 300 diseases, which is in average 20 times more than the average national screening programs. We have also developed other services, DNA file services, targeting from either to analyze either sick people like children with intellectual disability, or in preventive actions, as for instance in athletes to prevent.
We lost you again for the volume. Can you try again? it might be a network issue. So try refreshing, and we will have you back here again.
Hello?
Yes, you're back.
Yes, probably I will switch my camera off so that...
That is fine. That is fine.
Okay. So actually what we do is we are a genomics as a service company, and we enable the ubiquitous DNA data access to support individualized healthcare decisions at the clinical desk. So we make the bridge between consumer genetics to healthcare genetics and genomic medicine. We are in a unique market position, focused, as I said, on clinical DNA screening for both symptomatic and asymptomatic as for to preventive actions. We are in between the traditional clinical genomics and the traditional lifestyle genomics, which do not screen for health conditions, but rather lifestyle options. So we are we are at MVP stages. So we have passed all the entire proof of concept technology, clinical and MVP. We have just entered the market this year, and we expect sales to grow exponential. We are on the edge of massive paradigm shift within consumer genomics and clinical genomics. And we are actually untapping a new market of a DNA-based personalized medicine where genomic data analysis will be used as a routine clinical decision support tool and as frequent as, for instance, blood tests or X-rays. So we are now raising a 5 million round to scale sales and to enter different markets, and we are aiming to grow internationally. So all over the world, over 1 billion people has a DNA alteration that will cause a disease, for which there is already a clinical action that we can actually stop, prevent, and mitigate today. Will you join us in our mission to impact these lives? Thank you for your attention. And I'm sorry for the technical issues, and I will be on room 4 in the business meeting area. Thank you.
Everybody, let's give it up for Anna once again. The first pitch of the day, no doubt there will always be some issues, but Anna made it well, right, all the way through to the end of the pitch. Thank you, Anna, once again. Now let's move on to the question and answer portion, all right? If there's any Q&A, any of the questions from our investors that are panelists that are seated up there today, maybe I will just call a name, and if you have a question, of course, you could raise up your hand. Remember to unmute yourself. Let's start off perhaps with Stamp from Creative Ventures.
Go first. So thank you for your patience. Yeah, it's very understandable for all technical. My first question for you today is, I'm wondering who will be your main target customer in the area. Yeah.
My techie customer in the Bay Area or in the business? So our main customers are our target is the people, the individuals, but we aim at doing business with clinical settings and healthcare industries, as they will be the users of the information.
The channel that you are planning to do?
Sorry?
What sales channel? Like you're gonna do online or any like distribution partner with the healthcare or hospital?
Yes, we aim to make partnerships with hospitals, with insurances, but especially we aim to be at the clinical desk. So we want to engage as many doctors and, of course, as many healthcare units as possible that would be delivering our genomics as a service and using them on their daily clinical practice. imagine what it would be if you would go for your urologist and he can just simply click and understand if you have a pathogenic mutation, for instance, in prostate cancer. This is actually life-saving.
Thank you.
Okay, thank you for that question, Stem. Next question, I'd like to actually direct it to Ms. Zhu Tiantian, the VP of Strategic Investment of New Frontier Group. My apologies earlier. There was a misunderstanding of New Frontier Group. It was actually the largest hospital chain actually in China itself, right? So, Ms. Zhu Tiantian, any questions from your side?
At the website of the company, I have a small question for you. I saw that actually you have different products for this, like you're doing like genomic sequencing, right? So I wonder, like, what will be the what will be your technology differentiation from other players in the market? Because I'm looking at the website and looking at the product, it seems like that you are doing like the consumer product side as well as the clinical product side. So you are doing the disease screening at the same time, and then you are doing the 23andMe, the consumer at the same time. So would there be any technology differences between you and the other players in the market?
Considering we are opening up a new business, a new way of doing business, which is we consider to be B2B2C. So we are actually targeting consumers, but within clinical settings, and we are lining up these two sectors that are already very strong, both in the clinical and the consumer lives and the consumer sector. What we make different is that our patent, technological speaking, is our patent, where you can have your DNA sequenced once and we store the information. So, for instance, in an adult, we can do a DNA athlete if someone wants to screen for a sudden death condition. And later on, we can run the analysis of parent, millennial, cost, and prostate. We can use the data a long life. So first analysis is going to be more expensive because we are sequencing each and every single gene. And this is the major difference from consumer genetics, because consumer genetics, you are looking for what is known. And whereas we are sequencing everything, known and unknown. So we can actually make data usable for the future. And afterwards, and after this first initial analysis, you can have access to your DNA sequence and reanalyze for whatever the condition it is at a very cheaper costs.
Okay. I hope that answers your questions, Mr. Tiantian's questions. I think we actually are up for 10 minutes. So our time is up here. Thank you so much, Anna, for answering those questions in your presentation today. So we will take the opportunity later on at the business matching platform, the venue, to actually engage and share a little bit more for your questions. Thank you so much for your time, Ms. Anna, everybody. Let's give it up for Ms. Anna from CBR Genomics once again. Okay, and right up next, we have our second pitch for today. Second pitch is by Neros, and we have Mr. Pedro Pestana from Neros that will join us up on stage to actually do the pitching. Give us a second. Please hang on a second while we sort out some technical glitch here once again.
Great.
Okay. Thank you. Once again, we have Pedro from Neros. Sorry for that technical glitch there, everybody. Once we went back onto the second pitch. Pedro, once you're ready, please share your screen and I will start the countdown timer from there.
Okay, perfect. Thank you very much.
The stage is yours.
Hello, I am Pedro Pestana, and I hated myself as a child. I was the most nervous person that I know. I was barely able to communicate with people. Doing presentations in school was so horrible. And I was a football player that had so less confidence during matches. So when I was 14 years old, I promised myself that I will grow every single day of my life. So that's what I had been doing during these last 17 years, trying to do anything that you can imagine, from meditation to affirmations, and going to psychologists, coaches, etc. So after these 17 years, I am able to be here running a deep tech company, presenting to a lot of people and be proud of my mental development. I know that I can grow even to super abilities, but imagine that you can convert these 17 years of developing and development of the mental part in just 6 months. So this is not just important for me. This is important for the 12.5% of the world population that have a mental health disorder or are almost getting there, and for the 1 trillion annual global cost of mental conditions such as depression and anxiety. So Neros is actually the technological revolution of mental health and performance. We have 3 main pillars. We read brain information, we train the brain, we are able to quantify mental abilities in the brain with biomarkers. We are unique in the world about this, and we are able to predict the evolution of the brain's abilities in the future. So we know that different regions of the brain are responsible for different functions. So we use an EEG that reads electrical brain activity, and we send this information through the platform, our Neros mental training platform. In the platform, the athlete needs to be seated on a chair, looking at the screen 2 times, 23 minutes per training, actively trying to execute things like, for training emotional control, for example, thinking into positive things, relax, breathe deeply, to try to activate a particular region of the brain responsible for emotional control. So it's like being in a gym. He's trying to push up this spaceship just with his brain and with his mind. And it's in the gym, you're in the gym pushing a weight at a gym, building this specific muscle. The same thing happens with the brain because of neuroplasticity. Every time he's able to push and activate this particular region of the brain, he's developing new neural networks and reinforcing them. And everything is quantified. We know how you're evolving during your training and how you're evolving from training to training, going from the abstract of the mental part to the concrete of the biomarkers from the brain. So here you have the Neros 2.0 solution that will have all the mental abilities in a dashboard quantified and the expected evolution in 1 year, the prediction of your evolution training with us and with our platform. Okay, solution is good, but is this team suited for this business opportunity? And I tell you, yes. We are a science spin-off, a university spin-off from a science university in Lisbon. Our co-founder is Professor Hugo Alexandre Ferreira, medical doctor, PhD and neuroscientist, and we have a multidisciplinary team of neuroscientists, medical doctors, psychologists, experts in neurofeedback, deep tech developers, serial entrepreneurs, and also a board of advisors with a lot of experience in business that are giving advice to us. And this is not a woo-woo thing. We already won the Best Innovative Research Award in the International Scientific Conference, Physioma, and were invested recently in Europe and also in the US. And Neuro's 1.0 solution got impressive results. We are able to improve almost 10% in self-confidence, more than 20% in faster decision-making, 2 times emotional control, almost 15% of reduction in anxiety in less than 3 months. So our case studies show remarkable proof of success in the most diverse fields, including competitive sports, business corporation, and health. And after these case studies, we are actually entering the market with our first clients, with a solution as a service business model, business to business, and it is the fast €400 per equipment per month to develop one mental ability. And with our technological pipeline, we will be able to train more mental abilities, quantify them, and use AI, super intelligence to achieve the 3K per equipment per month. The business is easy to explain. We buy one EEG device for €800, and the minimum life expectancy, it is 2 years. So we rented it monthly for 400 at minimum. We are growing in terms of this. And in 2 months, we cover the costs and the rest is profit, almost 9K at minimum per device. So in future, we will increase the selling price and reduce the cost of the equipment. But there is a market to this unique business opportunity. Yes. Neuro's total addressable market is more than 100 billion because we are talking about sports and corporate, what we are focusing right now. We want to focus just in one, but we are trying to understand with the market what is the best one to proceed because we have this demand. And in the future, we can go to education, to neurogaming, huge in Asia, to health, huge in Asia and China. Mental health is really important topic to pursue. So in terms of our pipeline, we created our MVP, first client also design business model. And right now we are developing our technological pipeline to enter in Europe and to quantify different mental abilities. And with it is the first time in history that we will have a super intelligence AI training the human mind to develop itself. The first time in history. So we are asking for 2 million to hire more AI expert software developers and data analysts, buy equipment and pay testers, and commercial expansion to Europe and put a fit on Asia. So join us in this technological revolution of mental health and performance with Neuros. Thank you.
Exciting sharing that you had. Very interesting. Now let's move on to the question and answer portion. For this round, may we first invite Ms. Wang Dan, Executive Director of Typing Innovation Capital. Wang Dan, do you have any questions for Pedro?
It's a very fascinating. Can you hear me?
Yes, we can hear you.
Okay. It's a very fascinating technology, and actually quite a lot of companies in China also developing the similar technology. I'm quite interested in the slides when you introducing your test. You have worked with some corporations and some sports team with some tests. Can you go back to that slide?
So this one, right?
Yes, and this one. I would like to know that how many cases
judges up there, if you have any questions for Pedro, please feel free to ask. Anyone? How about Randy?
Yeah. Hey, Pedro. Can you walk us through what's your current traction like, and how long since you founded the company?
2019, end of 2019. Initially, we focus on drug discovery using quantum mechanics, but the early stages. This is very interesting because the impact we would have is very low. So we developed this technology and partner with Institute in Italy and also the University of Manchester. We also have another area in the company, which is medical diagnosis using imaging, CT scans and X-rays. This happened because of COVID. We now expanded to other pulmonary conditions. And this is because we have expertise in artificial intelligence and computer graphics and computer vision. That's basically what we do in the company.
The response, Randy, was that what you were looking for?
We can talk more after that, I guess.
Yes, we are looking for some funding and also collaborations in China.
Wonderful. I think a lot of our investors here today would be able to help you in that area. Any questions from the rest of the panelists here? Anyone would like to shoot a final question?
Okay, just misclicked. So yeah, for the company, because I checked your official website and I couldn't log in. So I'm just wondering, have you been able to build some collaboration with maybe some of the biotech or some of the pharmaceutical companies, some of the MNCs, or do you have already some internal pipelines to kind of demonstrate your ability to do all the preclinical researches where you develop the tools?
Well, we are collaborating with these two institutions to develop the technology. We don't have any collaborations with pharmaceutical companies. The access to data is very secretive, so we need to develop a trustworthy relationship with them, and they need to be part of the development process. So this that didn't happen yet. So we have been dealing with academic or private but academically oriented institutions, not with the pharma industry or the biotech industry yet. But we are looking for that collaboration.
Okay, thank you.
Okay, thank you. Just nice we hit the 10-minute mark. Thank you so much for that question, Chong. If there are further questions that you have, you want to clarify with Pedro, let's meet up at the business matching venue later on. All right. Once again, thank you for that question, and thank you so much, Pedro, for sharing with us your pitch today. Please join us at the business matching venue later on. Okay, ladies and gentlemen, thank you for your patience. I think we are down to 6 startups for today. The next one we have here is Hope Care. Hope Care is represented by Simao Collado. Simao, if you're here, would you join us on stage, please? Hi, Simao, are you here with us? Can you hear me, Simao? Hope Care representative, Simao, if you're here, please join us on stage.
We're here.
help doctors to do that. The second is that in fact, we are working for 7 years already with public hospitals in Portugal. We have more than 16 public hospitals working with us that allow us to achieve a huge impact. For instance, in COPD patients, we could reduce in 50% the reduction of hospital readmissions and 30% in emergency rooms visits. Then we went also for 6 years monitoring heart failure patients, and the impact is really high. And because the algorithm today is more predictive, so we are developing predictive algorithms, we can intervene on time, meaning that we could lower, for instance, 85% of emergency episodes in this case. And most important, because we worked with Portuguese NHS, it was to reduce the cost. So for payers like insurances or NHS or hospitals, the important is that we can leverage the quality of life with patients with a very secure way, but at the same time, we reduce between 51 to 61% of the cost of that patient. And of course, in Europe, when we look to hospital readmissions, we can avoid a lot of hospital readmissions, so the ROI is really, really big. So for us, the future is very, very strong. So today, we already leverage and we complete a 3 million round to go to Europe. So we are today acting in Austria, Switzerland, and we are entering also in Germany and Belgium markets where the reimbursement process for these kind of solutions already in place. And of course, for Asia, what we are looking for is for partners that can make a partnership to speed up our validation in the market, in your market, and go fast also in that market. And what we can tell you is that, in fact, we are a manufacturer, we are registered in EUDAMED, we are a clinical validation already done. We work with very important hospitals. We are Microsoft preferred solution, so we work also with Microsoft across Europe, and we want to bring you also this knowledge, and of course, we truly believe that we can make a difference in the market. Also to show you that today we are, for instance, we won the STEM for Health from Bayer, so we are working also in pharma business, linking out our technology with medicines, showing the impact and analyzing the impact of the medicine, or for instance, screening population in an area like Basel in Switzerland, or of course, the COVID is always important to say. For instance, with Stat of Ian, we monitor the patients of COVID patients with our solutions with a very, very high impact. All this with a very smart team, so we are very young, but of course, in management side, we are very, very strong. And of course, thank you. We are open to questions now, and I think I hope to have someone to ask.
Thank you for your wonderful presentation from Hope Care. Let's move on to the question and answer portion. I think, very interesting. Let's point this question towards the Taiping Innovation Capital, Wang Dan. Would you like to start off with any questions from your side?
Ask these solutions. Actually, we seldom have seen this kind of similar solutions in the China market, which means it provides a cloud-based platform instead of a wearable device, and your solution is to collect the data collected from the consumers and to the doctors, right?
Yes. What we have done in these years was to solve the interoperability problem between the different markets and brands and put all information and standardize this information in one place. So this is the first goal. The second was, and today the investment that we are making, for instance, this 3 million that we are already completed around this year and we are investing, is in the research, is about the predictive algorithm. What means from consumer side today we get information, of course it's important, but we can in fact in advance, for instance with COPD patients, we can with 5 days in advance understand that patient go to the hospital. So what we do in our system is put these algorithms working to advise the doctor to see the patient and avoid them to go to the hospital before he have an acute problem. So the future, in fact, is of course more about algorithms, proprietary algorithms to predict. So this is our main area. Of course, I understand that there's a lot of IoT device, medical device connecting with mobile applications. Okay, for us, it is not that the problem or the technical issue. That is really simple. The very strong proposition for us is the algorithms to analyze that data.
My question is that because in China, the data collected from the individuals can immediately to get access to the doctors. It does not have this kind of the system or environment. So can you share with us how does it happen in your country?
Yes. So in triage, we have bots that at first level they analyze and they advise the patient. Is not human resource. So we are lacking of nurses and doctors. So we don't have doctors for everyone. So what we are doing is to make more intelligence the decision before go to the doctor. So we have this triage. It's like when you go to emergency room, imagine that, and the first question they made to you is to understand where you need to go or what is your condition, and then they redirect to the doctor in the emergency room. We take this example to make the same in online. So today, what we have done is that you, for instance, measure your glucose, and the system analyze your risk and then advise you to do something. For instance, do it again or repeat or walk and make several advices. After a while, you screen again that patient, and if you see that the risk is continuous leveraging and going up, is then when we decide to send to the doctor. What it means? It means that today in Portugal, for instance, we have one nurse that is handling with 700 patients in one time per day, and one doctor handling with 10,000 patients per day. So what we improve is the process of decision with our technology and algorithms in order that we can have more patients for one doctor, because we have not doctors for everyone. So that is the main problem. And with that, what we proved to the state, for instance, NHS, and the results are published, it was that we can, in fact, reduce the cost of the patient because we can detect in early stage that he is going to have a problem. So online, the doctor can talk with the patient and say, you need to correct, for instance, medication. And with that, you avoid that the patient go to the hospital, consume resources in the hospital, and at the same time, occupying a bed hospital for that. So with this, in fact, is a production, improving the production way of we look into the population and screening population.
Thank you, Simone and Hope Care for explaining this. Sorry, our time is actually up for this 10 minutes. So I know you're getting into very interesting conversations here. I hope that you guys can actually meet at the business matching venue there to continue this very exciting conversation. All right, Wang Dan, thank you once again for your question.
Thank you.
Thank you for your pitch today, Hope Care. Thank you. We'll see you later at the business matching venue.
Yes. Thank you. Thank you. And success for all.
Thank you very much. It was a very good presentation. Okay, you may have a seat at the audience. Now, let us move on to the next startup here today. We have Ablood, our 8th startup for today. Ablood, we have Representative Nuno. Nuno, if you're here, please join us on stage. Nuno of Ablood.
Hello.
Hi, where are you? Are you on stage? Here we go. Yes, Nuno, welcome on stage. Thank you for joining us today. Well, if you're ready, likewise, the format of today's pitch is you will have 10 minutes to do so, and 10 minutes include your pitching plus some Q&A, question and answers with the panel of judges and the investors sitting at the rate so far. So when you're ready, you may share screen and start pitching.
So I hope you hear me clear and you can see the screen sharing. So
yes, I can hear you loud and clear, and we can see your screen now. The stage is yours, Nuno. All the best.
Okay, thank you. And thank you all for this opportunity to speak a little bit about what we are doing in terms of getting you the best way to know your health. So the problem starts with the fact that many diseases are called silent disease because they show no symptoms until their later stage. Cancer is one of these diseases, but you can think about diabetes, for example, that just in Portugal, 10% of the entire population suffer from diabetes, and half of them don't even know, and they don't even suspect that they have these silent diseases. It's true that the current methods to detect and diagnose this disease fail in many aspects. So what we have done, it's simply the best way and the easiest way to allow people to do examination. We embedded a medical device that is able to subtract a urine sample, prepare the urine, and analyze this urine. And this medical device is embedded on a toilet. You can see it in the left side of the screen. It doesn't look like a regular toilet, but you can use it regularly as any other toilet. So this toilet makes all this process entirely autonomously. It doesn't require any human intervention. So one of the features, some of the tech novelty that we embedded on this medical device is the ability of the lab on a ship that is working on the medical device could be renewed after its use. It means that instead of being disposable, it stays in the toilet being used. And this allows an extreme reduction in terms of the analysis and the cost that we charge, and we can go to the market. And at the same time, it just analyzes 16 biomarkers at once, at the same time. So for starting, we are analyzing diabetes, kidney disease, and these other diseases that you can see on the left screen. And these are biomarkers that are already very well validated on the market and by the scientific community. But at the same time, we are searching for another biomarkers related to oncological disease, to these cancers, may have others. We started with biomarkers that have high specificity and sensibility. However, we still need to do our own tests. So this also is a great equipment for research and development to check out about the other biomarkers that still are to validate. So in terms of business model, we start by installing these sanitaries, these toilets, on the medical facilities like hospitals or clinical centers, the place where you go to visit your family doctor. The process is very simple. When you get to the center, when you do the check-in, someone gave you an NFC card. While you were waiting on the room for talking with the physician, on a waiting room, you can go to the toilet, use the toilet regularly, and the results will be sent via cloud. They will be stored on the cloud, and when you enter to the physician to talk to your physician, he can access directly through this cloud. So when I mean that this data is stored on the cloud, it means also that we can make metadata related to this information. How we are charging for this? We can charge for cost for patients that going to these hospitals. We can, of course, charge to the hospitals themselves, not exactly to the physicians, but for the management of the hospitals. And we are charging also for this metadata that we can provide, and we can provide to pharmacy industries and insurance and R&D entities, as I told you. And what are they getting in case of pharma, insurance, and R&D entities? We provide them a software where they can analyze, for example, in this image, we can see an example of what pharma gets. It gets, with this information that we can can collect, pharma industry, a company can see exactly what kind of patients related to chronic kidney disease, for example, are occurring in the first and quicker than any other answers that are in the market. It also can see statistics and other features, but it can do it first than their competitions, than their competitors. For starting, we are not charging for patients. We are installing this on the medical facilities. We are requesting to these medical facilities a small subscription, something very cheap to afford monthly, and we are providing this data information to pharma industry and later on to research and development entities, as I told you. Of course, the market, you all know, it's growing, but we are here only referring to the part that we charge a small price for the hospitals. This is our team. It's people that are from different areas, from IT to medical, physicians, and we're still few. We are a early startup, but we are growing and we have the basis to do it. One of the proofs that we gather great institutions in Portugal, most of them, early adopters, for example, like Bayer, and we have been approved with a grant of 1 million euros in this consortium of entities that are developing along with us all this technology. So we are in this time fundraising. The great news is that we are almost run with these needs that are required for certification to hire more people and to finish the lab on a chip certification. So in the terms of roadmap, we hope that to have revenues from medical devices starting of 2024, to make the pilot project along with other partners in the end of 2023. But before that, we have already done the toilet. And by the way, the toilet has a live without the medical device. It's a second product, or the first product that we have, and it's done already. It's ready for industrialization. Saves 92% of water, and it saves and it washes entirely after each use with this small amount of water. So we have talked with great promoters and real estate builders in Portugal. We have large sales to deliver them, and we hope to start making this revenue just in the next year. So I hope you can reach out to me if you have questions that I cannot answer after this presentation, but meanwhile, just let me know what I can explain better about our business. Thank you.
Thank you so much, Nuno. Thank you. Once again, it looks a very, very sleek design toilet there, right? Now let's move on to the question and answer portion here. Let's start our question here right now for this session with perhaps Tian Tian from New Frontier.
Yeah, I just have a small question. Is it clinical medical will? So how do we, like you say that they will be able to help to diagnose some patients' disease in early stage, right? So basically, it will be a medical device, or it will need some clinical data. So how do we, how we are talking to the regulatory for now, how we prove that our, how we get, do we have any clinical trials for the data we gather now, and then do we have any study for the data we have now to prove the accuracy and then the specifications of this data, and then to for all the diagnosis that we can provide?
Good answer.
When it comes related to oncological disease, we have selected a panel of biomarkers well validated on the scientific community, as I told you, with a high sensibility and specificity. So anyway, although we have these papers, we do have still need to do our own examinations. We are working with the Institution of Oncology, Portuguese Institution of Oncology, in terms of getting done these validations of these biomarkers. In terms of the rest of the disease, as have been shown, for example, diabetes, or chronic kidney disease, we are using biomarkers that are already very well validated, so they are regular. So the work that is need to be done in terms of the biomarkers related to oncological disease, we are doing it with some other partners, and still I will say that besides the fact that we are validating it, validating these biomarkers for absolute use, for using in this equipment, we are also providing some kind of information the research and development find until this moment very, very hard to find, because we can check a great number of persons very easily, amplify the sample that are required, and we can contrast with another parameters that maybe for the days, for the time being, it's difficult to study.
Thank you, Nuno. I hope, Tian Tian, your question was answered.
Yes, it is very clear.
Okay, thank you. Thank you, guys. Unfortunately, we don't have much time for more questions, so 10 minutes is already up. Nuno, thank you so much for pitching today. I hope you get the chance to later on have a more one-to-one personal conversation with the VCs at the business matching venue itself. All right? So please stay around. Yeah, see you later at the business matching venue. Thank you so much for your pitch today, and thank you for the questions from Tian Tian of New Frontier. And next, we are running a little bit late on schedule, but don't worry, we'll proceed on strong. Okay, we're going to invite Philip from Radiation Imaging Technologies. Philip, right on the spot. All right, Philip, thank you so much for putting us on stage. Can you hear me? Hi, Philip. Are you? Yes. Okay. Hi. Perfect. I can see that. I can see your screen right now. I can hear you. Can you try? Can you see everybody? Can you speak?
Yeah. I hope you can hear me well.
Your audio is great. Thank you.
Okay,
so the floor is yours. I think you're familiar with this, so I'll let you take it away with your presentation. All right. You have 10 minutes. I'll kickstart the timer when.
Okay. Hello, everyone. I'm Felipe from Rita Radiation Imaging Technologies in Portugal. I'm going to show you what we're doing to increase global access to better molecular imaging research and diagnostics with our innovative PET scanner technology. As you may know, positron emission tomography, or PET, is a powerful medical imaging technology. It's very important to detect cancer or neurodegenerative disease. It is capable of seeing what other technologies cannot see, very deep inside the tissue. The problem is that PET scanners have always been very complex, heavy, and expensive machines. And also they are not able to adapt to different sizes of bodies or organs. And all this limits the scope of their use and potential benefits. We believe that this wonderful technology should be much more available and easier to use. And this is our mission, to increase the global access to PET imaging. For this, we have developed a new technology of PET scanning called EasyPET that is essentially a smart scanning method that uses only 2 rotating detector blocks instead of the typical ring system. And in this way, it can cut costs and the weight by up to 10 times and achieve very high spatial resolution, which is important to distinguish the small tumors, and also having the capacity to adapt the scan to the size of the field of view, which is important to image bodies or organs of different sizes more efficiently. This technology is patented and was already granted in USA and Germany. We have built the first product based on this technology, EasyPET 3D, which is an entry-level preclinical scanner for research on small animal models. It is not yet a medical device. We are starting on the preclinical PET. And besides a unique price and spatial resolution, other advantages of EasyPET is that it is very compact and has a very fast image reconstruction time. So being a very light, compact, and inexpensive system opens up the way for new applications and facilitates access to high-resolution PET imaging. In 2021, we started our first sales of this scanner, which already has several users, such as the Institute for Nuclear Sciences Applied to Health in Coimbra, Portugal, where some of these studies and images shown were obtained. And we are now moving up towards higher sensitivity and larger field of view. And we are building a more advanced preclinical system. We call it iPET. And we are growing from 5 to 12 centimeters in diameter. And our goal is to scale up the technology to build a unique clinical scanner for brain and breast imaging with up to 28 centimeters, and which is able to adapt to different sizes of head, or to image the field of view that it is needed for that specific application. So, so far we've already raised more than 2 million euros for R&D projects, mainly, including those to build the EasyPET and the iPET systems from a private investment of about 100K. We have the revenues from services and first sales of systems, which together with awards and prizes that we received so far amount to more than that private investment that we had. We are a highly skilled and experienced technical team, and we also have finance and business advisors and many academic and industrial partners. But we do need further investment and support to strengthen our business development. Our plan to scale up and address the global market includes partnering with research groups and other companies for joint developments and for the distribution of our products worldwide. We are looking for additional support and investment of 2.5 million euros that can give us that push we need to scale up our products into the clinical field and help us in our mission to increase global access to better molecular imaging research and diagnostics. Thank you. I am up for any questions, and I will also be in the room 2 of the matchmaking hall. I don't know how you call it. Can you still hear me? Hello?
Philip, can you hear me? Hello?
I can, yeah.
Oh, okay. Yeah, just trying to understand one question. How big is your market size?
Depends on which market we are talking about. If we are talking about the preclinical market, it is relatively smaller than the brain or the breast imaging market. So we are first addressing the preclinical one, but our ultimate goal is to get to the larger market, which is the clinical one. So it depends which application we are talking about. So I can throw a number for brain imaging market or breast imaging market, but that is like the whole picture. We are addressing a specific imaging technology, which is PET, or nuclear and molecular imaging, and this is smaller, but it's still on the range of about 1 billion worldwide. on the preclinical one, it's smaller.
Sure. Yeah.
Thank you for the question, Randy. How about Andre? Andre, do you have any questions?
Oh, I do actually. Can you guys hear me?
Yes, we can hear you.
Awesome. I tried before. I thought it didn't work. Sorry. Good pitch. Thank you for the pitch. I think it is an all important type of demand that actually is needed in the medical sector, right? So the PET technology, it is quite well known and used, and as you mentioned, is expensive, right? So this applies to the hospital itself, but also to the end consumer, right? So it limits the actual access to the diagnosis that is actually the technology can provide. So my question here is, what you believe, because this is such displays such much value to the actual end user and for the doctors and for the institutions. What you believe can be a potential roadblocker for you guys for the adoption of such?
The roadblocker. Well, we open up the possibilities with our compact and inexpensive systems, but there are some other demands for PET imaging that have to do with the infrastructure, that surrounding infrastructure besides the scanner itself, and this can be a limitation for many potential users. The access to the radiopharmaceuticals or the facilities to deal with this like hot cells and radiopharmacy, but I think that and the use of radiation imposes some limitations on the or some requirements for the institutions that do this kind of imaging. So this can be a roadblock for many. But we are easing the access to the scanner itself. It's a first step, and we can facilitate the other processes also. The licensing and helping the institutions to get through all this process that they need to actually do the PET imaging and have the scanner to do it.
Okay, thank you, Philip. Thank you, Andre, for the question. Andre, if you have further questions, we could take it off to the business matching center itself for the question. All right. I think our time is up. So, Philip, thank you so much for your pitch today. We'll see you later at the business matching venue. All right. Once again, that was radiation imaging technologies. We have Philip there. All right. And next up, we have our 10th startup. Our 10th startup here would be Vitor from Crime. Hi, welcome on stage, Crime. Vitor, can you hear me? Welcome to the center of stage, please.
Okay.
Perfect.
Yep.
Welcome, Vitor. Vitor, the stage is yours. You have 10 minutes. It's up to you to pitch a little bit faster and go with more questions or vice versa. Okay, so once you're ready, you can share your screen and we can hear you loud and clear. I can hear you. So you might want to put your presentation on and let's check if we have the
It's on, right?
Yes, okay, we can see it. Perfect, very clear.
Thank
you. Now you may begin.
Very much. Okay. So hi, my name is Vitor and I'm a Cream founder and CEO. First of all, thank you very much for this opportunity. So we are Cream. Cream stands for Chemical Reaction and Image Analysis for Mobility. We can detect every visible reaction you can think of in a portable and automatic way. We started by blood diagnostics because of the huge market and the huge need worldwide. Inside blood, our beachhead market is blood typing and infectious diseases. So the lack of affordable and portable, automatized and accurate mobile diagnostics is real worldwide. TB and COVID-19 were two of the biggest killers in 2021 that could have been minimized with efficient diagnostics. So that's why Cream created a portable medical device that can execute these tests in a question of minutes. So Cream has preloaded reagents, so antibodies and antigens, inside a cartridge that you can see on the top right. We just have to add some drops of blood and insert it into the device. The device will create the right set of movements, so almost like centrifugation, in order to accelerate the reaction between blood and reagents. At the end, the computer vision and AI algorithms will work and detect the right result for the test. So, Cream is faster than what exists right now. It's much more affordable, more accurate than the traditional gold standard for this area also. Really important is that we can execute the test anywhere, and not only in hospitals and laboratories. And we can execute multiple tests with the same device. So Cream has a patent for the hardware and process, already issued nationally and in the US, currently pending in European Union. But the real secret sauce for this is the computer vision and artificial intelligence algorithms. We will also file 2 additional IP during this year. So market opportunity is huge for the in vitro diagnostics, and based on the contracts that we already signed with international distributors, we consider our initial obtainable market to be 28 million. So we have competitors, of course. They are the biggest pharmaceutical companies worldwide, but they only can execute these tests in laboratories and hospitals. So we are the only solution for the point of care area doing this kind of tests. Business model is really simple. So we will sell the device one shot or at zero cost, depending on the annual commitment for the number of cartridges. The cartridges are actually one of our recurrent revenue streams. Then we have the diagnostic algorithms that could be added in the software as a service platform, depending on client needs. We will start sales in the US and European Union, and then we will handle regulatory in China, South Africa, and India, where we already have solid relationships and distributors. In terms of verticals, we can focus initially in the emergency services, hospital groups, pharmacies, and clinics. So we have created our revenue forecast based in half of the estimates that we have from international distributors. In terms of investment, we are backed by SOSV, is a San Francisco venture capital, and Artisan, and they are from Hong Kong. SOSV owns Axe, that is the biggest hardware accelerator in Shenzhen, where we lived for 6 months to create the first version of the device. We also have comfort letters from hospital groups where we've done the clinical trials. We have 99.79 of accuracy, and that is more than enough to handle FDA, CFTA, and CE mark. So, as you have already seen, our objective is to develop thousands of tests that could run in the same device. For that, all we need is enough blood samples contaminated with a specific disease in order to train our algorithms. We have a great team in place, from PhDs in molecular biosciences and computer vision and artificial intelligence, with excellent people in the hardware area, finance, and also market access. In terms of business, so I have 20 years in management roles in multinationals such as Accenture, Xerox, and Microsoft. So, in summary, I just want you to remember that we are making affordable and reliable diagnostics accessible to everyone. We will directly impact people's lives, reducing economic impact on blood supply and pandemics, and we will have a huge market opportunity based in our devices as a platform approach. So, Cream is now raising our Series A to conclude manufacturing and regulatory. With this, we will start delivering devices to the distributors that already are committed. We are also looking for partners and distributors in China that could help us to scale faster. So, in a nutshell, this is Cream. Thank you.
Thank you so much, Cream. Thank you for your pitch today. We'll move on to the question and answer. We have about 5 minutes for this session. Any questions from the panelists here this morning? Sorry, it's already afternoon. Any questions from our Creative Ventures?
Hello, can you hear me?
Yes.
Yeah, thank you for your pitch. I'm wondering if you can elaborate more on where are you on regulation part?
Sorry, I haven't understood.
Where you on a regulatory level, do you have any, for example, FDA clearance or anything that is equivalent to FDA on any country? In any
Yes,
country?
regulatory. Yes, we have a predictive analysis from FDA, but we can only submit that, we can only apply for FDA as soon as we have the final device ready. So we are now handling the design to manufacturing phase, and we were actually doing that in Shenzhen, but now it's more complicated with the pandemic restrictions. So we have to have the final device ready in order to file for FDA and CE mark.
Okay, I hope that answers your question, Stamp. How about a question from anyone from Typing Innovation from Wang Dan? Or Tian Tian from New Frontier. Any questions from you guys? Yeah, Wang Dan?
You that if your device would like to enter the China market, you have to go through a new round of the approval procedures from the China FDA, China General Administration of Food and Drug Administration. Yeah.
Exactly, correct. So basically what we can do is, and we have studied that because we have international consultants helping us on the regulatory, we first will get FDA in the US, and then will be an easy process to convert that and to get CFTA. But yes, we need to.
My advice to you is that you can try to get the China FDA at the same time.
Okay, thank you very much. I will check that. Thank you.
Any other questions from the panelists, the VCs? Okay, any question from New Frontier? Tian Tian?
Any questions? Thank you.
Okay, thank you so much. Luke, how about Gang Lu? If not, I think, Peter, any last words from your side? You have about 1 minute. We'll wrap this up.
No, well, thank you again for the opportunity. I'll be in the business matching, and well, I'll be more than happy to show you more details about what we have about the clinical validation and our market. Thank you very much for this.
Lovely. Thank you so much for your presentation, Peter. We'll see you at the Business Matching Center in a bit. Thank you. All right, we're down to our final two startups today. We are slightly short on time here. We will continue on with Best Health for You. The next startup is Best Health for You. Sonia, are you are you here with us, Sonia? If you are, please join me on stage. Okay, Sonia, a countdown from 3, 2, 1. If not, Sonia has actually also prepared a video. So we will play video for Best Health for You if Sonia is not here with us. So okay, I think let's move on to the video portion for Sonia. Let's have the video presentation for Best Health for You. Tom, can we have the video, please? Okay, please enjoy.
This is AI, an all-in-one solution for remote wound monitoring. 60% of wounds take over 3 months to heal. This means that 60% of wounds are considered chronic, since they take more than the usual 45 days to fully heal. According with the study Epidemiology of Chronic Cutaneous Wounds in China made by Yufeng Jiang, chronic cutaneous wounds represent a major healthcare burden in China, mainly due to the augment of the prevalence of diabetes in elderly population. The average time for chronic wounds healing is 105 days, and 10% of this type of wounds take at least 230 days to fully heal, and around 33% never heal. As you know, this is a burden for patients, healthcare practitioners, hospitals, and healthcare systems. Using 30 to 67% of nursing time, 27 to 60% of hospital bed resources, and up to 5% of hospital budget used to chronic wound care. A chronic wound episode has an average cost between 2.5k euros and 10.8k euros. To solve this problem, Best-L4U is bringing a breakthrough technology to market, an all-in-one solution which is made up of a smart dressing that connects to an app and a portal through the prediction algorithm. The ease of using our smart dressing is a bioformulation patented by Best-L4U, and it disrupts the concept of current medical adhesives. It's flexible, easy to apply, has a strong adhesion, and leaves no residues on the skin. It connects to the skin through hydrogen bonds, and it's biocompatible, maintaining the skin around the wound healthy. The smart dressing is connected to a digital platform, and its prediction algorithm allows to know the status of the wound and its healing process without removing the dressing and disturbing the wound. The sensors will measure key parameters for the wound healing process, such as pH, temperature, deformation, and the presence of bacteria. The app and the portal allow for both patients and practitioners to stay connected and evaluate the wound remotely, keeping the travels and consultations to a minimum. This will bring benefits to patients, and they see the costs and time spent caring for their wound reduced, giving them more quality of life. The healthcare practitioners will also spend much less time and hospital resources caring for these types of wounds, since it is all done through the portal. Companies will also benefit from the data collected from these wounds, being able for further develop new features for this or other products. Adhesive AI allows a faster, more reliable, and cost-effective management of wounds, which improves patients' quality of life by reducing the severity of their wounds and reducing their trips to the hospital. At the same time, Adhesive AI will also increase the quality of life of caregivers and families of patients. Comparing with the existing product in the market, Adhesive AI is more than just a wound dressing. Since it provides a more accurate assessment, is accessible from everywhere the patient is, and with no need to remove the dressing to know how the wound is doing. This product has a market size of 17 billions and billions of euros, and combines two market segments: digital wound measurements device and advanced wound care. And the Chinese market represents 20% of this global value. Our go-to-market strategy is based on a B2C-based business model, which revenues will be from hospitals and clinics. So far, Best-L4U has accomplished many milestones, recognitions, and awards. The last being an investment of 1 million euros from Linz Capital. Regarding our product development, after securing the MVP, we will start characterization and performance tests together with the preclinical studies. These developments are and will be possible thanks to our multidisciplinary and dynamic team with experts in R&D, biomaterials, life science, business, marketing, design, IP, and finances. We work closely with our partners. They are part of our team, and we are working Chinese market with Brightland China Center. We develop bio-based products with sustainable process, always aligned with Green Deal from European Commission and Sustainable Development Goals from United Nations. Our participation on Beyond Expo will allow us to improve our strategy to enter on the Chinese market and get financial support to grow faster in this dynamic market. To sum up, Bestel for You is developing next generation solution for skin interacting medical devices that improve your health and quality of life, maintaining your skin healthy by using sustainable biomaterials. Thank you all for listening to me, and let's talk.
For that pitch from Sonia. Sonia, are you here with us on the floor? If you're here, if you can hear me, please join us on stage for some question and answer. I understand that Sonia might be here with us. Yes. There you go. Hi. Sonia, can you hear us? You're muted.
No.
Now we can hear you. And there she goes, disappears again into thin air. So due to some technical glitches, I think we have Sonia here for us with the moment. Yeah. Hey, Sonia, can you hear us now? Okay, great. Can you join me on the stage, like to the center of the stage? Okay, wonderful. Okay, great. Yeah, we weren't able to find you earlier, so we actually screened your presentation. So now let's move on to the question and answer portion. We have a couple minutes left here. All right, so maybe we can get some questions from the panelists here that's still with us. Any questions from our VCs, from Typing Innovation Capital or New Frontier or Creative Ventures? Any questions from you guys?
I would like to know more about your market strategy. So, do you plan to direct to the consumers?
Our consumer is not the patient itself, is the hospital.
And clinics.
Yes. So our customers will be. Hi, my name is Nelson. I'm the CTO of the company. And the goal here for us, so we want to avoid the medical mistakes. So our primary customer will be the hospital and the practitioner itself. So it's the hospital that buy the software and the bandage, and will be the practitioner that will put the device on the patient itself.
Okay, thank you for the explanation. I hope that answers your question, Wang Dan. Any other questions? Okay, if there are no questions, as we're down to the last few seconds, any last words from you guys, from you, Sonia, and to share with the audiences here?
Yeah, so we are working our strategy to enter in the Chinese market with the Brightland China Center, and we want a new partner to introduce our products in the Chinese market and to define with us the better strategy for this big market. Thank you, guys.
Okay, thank you so much for sharing that. I think that's very important to make known your intentions. And of course, we will see you at the Business Matching Center for a one-to-one session with our investors and network with other friends and potential partners here. All right, once again, thank you so much for joining us at the very last minute. We enjoyed the pitch. See you in a bit.
Bye.
Okay. Now, can we invite now the last startup for today? Lucas from Decoy. Lucas, please join me on stage. Yes, Lucas. This Lucas is from Brazil and will be the last startup that we have here today. Lucas is representing Decoy. So Lucas, whenever you're ready, please share your screen, and you have 10 minutes to pitch as well as some question and answers. Can you hear us, Lucas? You're muted currently.
I'm not muted.
Okay, now you're good. Wonderful.
Can you hear me?
Yes, we can hear you.
Oh, great.
Okay.
So I'll share my screen.
Yes, please share your screen. And ladies and gentlemen, this would be our last startup for today. So after which, please stay and let me invite you over to the business matching platform where we can actually engage with the startups and the investors. All right, Lucas, we can see your screen right now. Feel free to kickstart your presentation.
Okay, so hi everyone. My name is Lucas von Zuben. I'm the co-founder and CEO of Decoy, a biotech company that develops sustainable solutions for pest control. The first solution we created addressed one of the biggest problems of this guy, the Brazilian cattle breeder. This guy needs to deal with a very painful pest, the cattle tick. This pest generates up to $3 billion of losses only in Brazil each year. And it's one of the biggest problems of Brazilian livestock industry. And the reason for that is that the tick suck the blood of the cattle, reducing the production of meat and milk. They also can transmit important disease for the cattle, which can cause the death of animals. And besides the tick, farmers have to deal with another problem. The current solutions available for them to treat this pest are based on chemical pesticides, which have several negative side effects, mainly because they are toxic for the cattle, people, and environment. And the worst part, they are no longer effective since ticks have developed resistance to the main compounds of these pesticides. So to solve this problem, we developed a biopesticide. We use fungi that are natural enemies of ticks, and as they are natural enemies only of ticks, they are completely safe for the cattle, the people, and the environment. And they also don't develop resistance in ticks. So, different from all of our other competitors, we can deliver a solution that is efficient against the tick and don't have any side effects. So, the technology, in this way, we can help the farmers to have a cleaner, healthier, and more sustainable productions. The technology behind these biopesticides is as simple as sophisticated. Each bottle of our biopesticide has billions of spores of 2 fungi species that, when are sprayed over the tick, attached to tick's body, grow and develop over it, killing the pest. So we are delivering this technology to farmers by a direct-to-farm model. So we have our own manufacturer plant, and our inside and field sales team deliver this technology to farmers. As a result of the value we are delivering to farmers, we are growing expressively. In the last 3 years, we increased our revenue by 6 times. And we also delivered over 700,000 of doses to over 1,000 clients all over the country. And that's just the beginning. The market opportunities are huge. Brazilian livestock industry, it's a world leader. With more than 200 million animals, we have the largest commercial bovine herd in the world. And we are also the biggest beef exporter on the planet. So there's a lot of space to grow. And we are not only looking to the cattle tick, there are several other pests that affect the animal health industry that we are looking for solutions. We are now developing a new solution, a new biopesticide that's aimed to control the ticks and fleas that affect dogs and cats. we are also developing a biopesticide to control the main pests of the poultry sector. So, with all the solutions, we are managing to build a platform of biological solutions to help the animal health industry. And we are only managing to do this because we have an incredible team that supports us. This team is highly qualified and it's comprised by several PhDs with a strong scientific background with other complementary skills are helping us to have success along our journey. But most important, it's a group of people that share a common purpose. We strongly believe that we belong to a complex and interdependent and interconnected network of relationships with all other living organisms. And we believe that we must develop technologies that can help keeping the balance of this beautiful and complex network. That's why we exist. Join us. Thank you very much.
That's a very nice picture. We hope that we can get rid of all those pests.
That's it.
Yeah. Thank you. Now let's move on to the question and answer portion. Q&A. Anybody would like to take on the first question with Lucas from Decoy? Questions from.
No. Yep. I'm wondering if do you have any close competitor in Brazil?
No, our main competitors are the chemical pesticides. We are the first biological solutions to control the cattle tick. So for the best of our knowledge, we are the first in the world to produce this biopesticides for animal health pests. Biopesticides are very common in agriculture to treat crops, but we don't know of other solutions that are used to biosolutions that are used to control pests that affect the animal health segment.
Okay, any follow-up questions from Stamp Creative Ventures?
Yeah.
Thank you for the question. Yeah, it's really interesting. And I think Dr. Gang, you have a question as well?
Yeah, thank you. That's a great presentation. I just quite curious because you mentioned about your solution for pets. Just wonder what's the stage for that? Is it already still in research or is it already in production?
Great question. Thank you. We are in the last phase of the registration process. So the products are ready for launch, but we are now waiting for the registration from the Ministry of Agriculture. But after that, we plan to expand and actually commercialize it officially. But now we are waiting the registration for the Ministry of Agriculture.
Okay, so if the pets one come into the market, so do you have any competitors? Because I understand for the cattle, you have technology there, but for pets, it's the same kind of situation.
Yes, exactly. It's the same situation. We don't have any other biopesticide that are aimed to control ticks and fleas of the pet. It's the same. As far as we know, we are the first company to bring this biological control concept from agriculture to the animal health industry. So, and that's opened up several opportunities to treat the pests and offer a sustainable solution for this market. And when we treat with animals, replacing chemical pesticides, we have another additional advantage that we can increase the performance of animals and also can increase welfare. So we have additional advantages when we bring biological pesticides to treat the animal health pests. But as far as we know, we are the first company to do that.
Thank you, Lucas. I hope that answers your question, Dr. Gang.
Yes. Thank you for that. Because I don't know much about the cattle market in China, but I'm sure the pets one will be a huge potential for you. Okay, thank you.
Oh, that's great. That's great to know. Thank you very much.
Thank you for the question. Any other questions from the other VCs, the investors? If not, I think we are down to like the last 10 seconds. Lucas, any last words? If not, we will sum it up.
Okay, no, I'm very thankful and honored to be here sharing our company with you. So thank you very much.
Thank you, Lucas. What a wonderful presentation. I think it's a huge market potential here you're looking at. Thank you for joining us today for this live pitch. We will now like to invite you to and all our startups to actually join us at the business matching venue. All right, the business matching venue to continue the conversations with the investors and all. Right. Once again, ladies and gentlemen, dear friends, distinguished guests, government representatives, organizers, co-organizers, thank you so much for sticking around with us. We are slightly late, but not to worry. We have completed all our presentation and pitches here today. We hope you have enjoyed the session, and also feel free to get in touch with any of the startups that you have witnessed their pitch today. I'd like to invite also some of our organizers. Maybe San, you can join me on stage so that our audiences and our startups here would know that if they'd like to get connected, they can also go through you to get connected with the startups itself. All right. So last but not least, I would like to invite you guys to our business matching center. So that would be the place that we will continue our conversation right after this. If you don't know how to get there, you can go to your left-hand side of your screen. There's a panel right at the first icon. You can click on that icon and select your venue, and you can scroll all the way to the business matching center. All right. Thank you once again for joining us this morning for this pitch session, the roadshow of enterprises from Brazil and Portugal. I have here on my left with me on stage is San. San.
Hi, everyone. This is San from Macau. So thank you for joining us today for this pitch roadshow. Now we will move on to the business matching as pre-arranged. The Brazilian and Portuguese companies will join us in the business matching center because we have got companies and science and technology departments, hospitals, VCs joining us for business matching. CREAM, number 10, the presenter CREAM should go to room number 1. Absolute Neurals and Radiation Imaging Technologies should make your way to room number 2. Best Health for You, I Love Tech need to go to room number 3. Hope Care and CBR Genomics, please proceed to room number 4. Last but not least, Fast Comp Cam, Ovantis, Decor, and Dark Diagnostics, please make your way to room number 5. We will be seeing you in the Business Matching Center. And if you guys have any questions, you can use the chat box to connect with us, or use,